Tuberculosis is a disease which thrives on the socio-economic inequities, necessitating people-centered approach to ensure that no one is left behind and that no child is left behind. It is imperative that we reimagine our tools, reimagine our approaches, better utilize data, and deploy innovative and collaborative efforts to find the missing children with tuberculosis wherever they are.
My name is Bobida. When I was coming, I cannot go to school, I cannot play, and I cannot speak because my chest was paining me. I was coughing.
The minute my son was having cough and malaria, he cannot sleep in the night, he cannot eat, his body was very weak. The cough started like 1 month plus. So I will go to the chemist and get him some syrup. The tea will get better. For a few times it will start again. So there's a day I was sitting here, so they now pass announcement that they are coming to Amac Hospital to do free X-ray checkup and give us some drugs. So when the day came, I now go with my son. They do the X-ray test for me and they also did for him. So they now told me that when the result is out, that they will get back to me. So I dropped my phone number, my name, my son's name.
When the result came out, we have almost 5 to 6 children that have this TB.
So when I went back for the result, they told me that Dominion is having tuberculosis. And they told me that I shouldn't worry, that it's curable. So they give me medicine for Dominion and they give me medicine for prevention. So I started giving Dominion the medicine every day, started taking it, and the medicine is free, everything is free. Both the X-ray tests, everything is free, even my own is free, Dominion own is free. So when I came home, I started giving him every evening before we sleep. So Dominion started getting better. The cough is over and he can go to school now, he can play around now. He's even having more strength than before.
Global Fund has already provided the drugs for the facility, so they don't need to buy. We don't sell drugs here, we give it free. Freely it came, freely we give. For children, so it's challenging, but being that is our job, and where I have passion for it, I need to go the extra mile. Health personnel should always look out for TB in children. It's important. And the joyful thing about it is that TB is curable.
So we are urging all our health workers that are in primary healthcare sector, secondary and tertiary health facility to integrate all these diseases and to look at the risk factors that are causing tuberculosis, especially in immunosuppressed children. Children with acute and chronic malnutrition, children born from HIV-infected parents, those with measles, all these are risk factors. So in treating those patients, they should also take into cognizance looking at signs and symptoms of tuberculosis, diagnosing it and treating it, so that we can also increase the case notification of TB in children. The annual TB case notification has increased by 26% from 285,000 cases in 2022 to over 360,000 in 2023.
In moving forward and in accordance with the global push towards universal health coverage and leaving no one behind, we felt that saving the life of children should be on the front burner. And so we decided to include other diagnostic platforms, innovations to make sure we have early detection of the diseases in all infected children. For instance, we've been able to come up with the innovation of making sure that every child that is malnourished at welfare clinic, the stool is taken for gene expert examination and to ensure that every child is not lost.
If the global world can recognize that, the health workers should, on their own, time to time, go out to the communities, go out to the schools, the mosques, the churches, create more awareness to them that TB is real for children. And the joyful thing is that it's curable.
My advice for parents is that when they notice that their children is having symptoms, coughing, they couldn't sleep, they couldn't eat, when they notice that, they should take their children to government hospital for free test. Everything is free. The medicine is free. The test is free. I did not spend 5 naira. And I thank God today my son is totally free from tuberculosis. No coughing again. He can sleep, he can eat, he can play and do all the rest.